The Clinical Command Center is a capability that was developed within Current Health to have nurses monitor patients on behalf of our clients. It is really expensive to stand up a clinical command center, so outsourcing it to us or having us provide that support allows an organization to start small with a program. We can provide the monitoring support, the staff, and the resources that an organization might not necessarily have internally. So we can help them grow and develop their programs, scale their program, and eventually, ultimately, as they grow their program, they can justify building out their own clinical command center or continuing to use us because they appreciate the service we provide.
Having the Current Health to where working alongside with the Baptist Heart Clinic made me feel less frightened and like more people were watching over me and making sure I was okay. I had some good support from the Current Health technology, knowing that the nurses were watching me and were going to call me if anything was wrong.
The Clinical Command Center is fantastic, and I think that the fact that they are not only addressing clinical needs of the patient, but also addressing some of those technical concerns. So if the patient does have questions, they're able to triage that appropriately and get those patients aligned with someone that can help them with the technical needs, and that's helping with our engagement. So those folks are also doing those helpful nudges back to the patient, which I think is very, very important.
The Clinical Command Center can provide 24/7 round-the-clock monitoring and triage support, or we can do a hybrid model where we monitor during the day or during the night, and then the organization picks up the monitoring with their internal staff.
In terms of scaling, it does give you that flexibility. If you don't have an internal clinical command center, or if you're trying to scale, our eventual goal would be to scale, but we don't have all that staff available yet. We don't have all of the resources that we need. So using Current Health Clinical Command Center to supplement and to complement what we have will be very, very pivotal in terms of that expansion.
We license all of our nurses in all 50 states plus the Virgin Islands. It makes us scalable. At any moment, we can stand up a program in any state in the United States or the Virgin Islands and start delivering care without any delay.